Good morning, good afternoon, and good evening to all of you. Thank you for joining today's session, the webinar that's hosted by the Sanitation and Water for All. Today's event is a special event, and the topic is "It Can't Be Normal: Inequalities in Water, Sanitation, and Hygiene Services Levels, the COVID-19 response, and the future." We hope to have a very exciting session today. Before we start, we'd like to take you through some few logistics arrangements. Kindly ensure that you select a language. On your screen, you see a language button. It looks like a globe. If you click on it, you will see the language options. Choose the language that you are most comfortable with. There will be simultaneous interpretation in English, French, and Spanish. And also there will be, for those of us who would not be able to hear, you can also look at the chat. There's going to be interpretation in the chat for those with hearing impairment. Thank you for joining, and I hope that you've been able to get yourself fully on board as we start the session. I'm giving you a few minutes to be able to do that, and then we'll start. The Partner Exchange Forum that you have joined today are a platform for learning on COVID-19 pandemic related challenges and across constituency exchange, an opportunity to share experiences and solutions, an opportunity for SWA partners to connect and build joint activities. This particular event has been co-organized by IRC and SNV with the SWA Secretariat and the SWA Research and Learning Constituency. We are fortunate to have 5 panelists from across the globe who will be joining us in having this interaction. Our panel members would include Arnold Ajagodo, who is an IRC staff, and he is joining us from Burkina Faso. We also have Mr. G. Mathivathanan, who will be joining us from India. Mrs. Ramadakar will join us from Nepal. And then we also have Engineer Godfrey Bwaruguba joining us from Uganda. We have Susu Seda joining us from India. So you can bear with me that we are truly going to have a global event because the issue of inequality is universal, and therefore having the different perspective on how people that are deprived of water and sanitation services are managing the situation with COVID. It's very significant to have the different perspective. Before we bring in our panel members, we'll have a presentation that will set the scene for the session today. And then it will be followed by the panel discussion. I've introduced to you briefly the panel members and where they are joining us from. It is interesting for us to know who is joining from where, and then also know a bit about your perspective and situation. For that matter, this program would involve 3 pools. The first pool would be about knowing your location and your water and sanitation state. We'll have a second pool in between to seek your views on some of the issues. And before we close, we'll have the final pool to seek your views on your takeaways from this session. You are most welcome. We're going to begin by having the first pool, which would be on your screen, and kindly log in to register your responses to the questions. We have the pools posted now. We are going to have simultaneous interpretation because it is in English. So we're going to have a simultaneous interpretation in French and Spanish. So whilst you get the interpretation, you can check this on which is most appropriate to you. There are 3 questions in this pool. So kindly scroll down to be able to respond to all the questions. The third question is a multiple choice question, but I'd like you to select of the many questions, the question that is most frequent to you in where you sit. You are most welcome to this session. So let's please log into the pool to know where we are. Thank you. Kindly submit your responses when you are done. We have 1 minute to close the polls. Thank you for submitting your responses. We'll now wait for the feedback from the poll that we just had. Now our results are out. At the close of our polls, we see that most of us are joining from South Asia and Southeast Asia. We have about 22%. The list is East Asia with only 1%. Interestingly, we have no one joining us from North Africa. Europe is also, yes, there are many people joining from Europe. A whooping 42% of the participants are joining us from Europe. 99% of us responded that we have water, toilet, and hand washing at home. It is interesting. It means that maybe about 1% of the population on this call really are experiencing what we are talking about. But then statistics show that about 40% of the world population are without water and sanitation, proper hand hygiene services, and therefore it makes this subject quite interesting to talk about. we might be the privileged few. In the final question, we did indicate that in our countries, most of the interventions on COVID are focusing on hand washing and and hygiene promotions. Thank you for submitting your poll. We'll begin our session with having a presentation by Antoinette Com from SNV. Antoinette is the Global Sector Coordinator for Water and Sanitation and Hygiene with SNV. Antoinette, over to you at this point.
Thank you, Vida. Good morning, good afternoon, good evening, everybody. I see many familiar names, and it's a real pleasure for me to be able to share something in this webinar. Joost, you are managing the PowerPoint. It would help me if you are putting it in slideshow mode.
Antoinette, I have done that, but I have a little technical problem. We're resolving it right now, and the PowerPoint will move very quickly. Thank you. Sorry.
All right. Okay. Yeah, so I was asked to give an introduction to this topic in very, very short amount of time. So I'm certainly not going to address all the aspects of this. And the beautiful thing of the SWA Partner Exchange is that this webinar actually follows a previous webinar on equalities, which was done by WaterAid and the Collaborative Council on the 23rd of April. And also after this webinar, there will be a next webinar on the same topic. So we're really seeing a series of conversations about this topic. What I wanted to share with you is that while apparently everybody here in this group has water and sanitation at their homes, or 99%, I saw 1% who's using a shared toilet. There is, of course, about a quarter of people in the world who don't have water at their home. And there's 2 billion people who don't have sanitation at home. And with the figures coming out of the JMP, we estimate about 3 billion people who don't have a hand washing station at home. So COVID is raging through the world. You all know these graphs. This is okay, Joost, thank you. And no country is exempted from this, are they? Now trying to control Joost's screen. Yes. So WHO is telling us that there are a number of measures that we can practice to mitigate our risk or to protect ourselves from the virus. And you all know these measures around washing your hands, maintaining distance, avoiding crowded places, staying home and self-isolate. But as I said, the inequalities in access to wash services actually make it very difficult for some people to practice those measures. We see inequalities in service levels. Some people have service at the premise, some don't have service at the premise. We see inequalities in coverage. There's large areas that don't have coverage at all. Inequalities are linked to socioeconomic status. And of course, we also see social exclusion or difficulty of certain groups to use water all the time or use sanitation all the time at every time when they want. So where are those gaps? Who has those difficulties? If we're looking at the inequalities in WASH and the 5 countries that we'll be presenting here through the panelists, and those 5 countries are Burkina, India, Indonesia, Nepal, and Uganda. We look firstly at Burkina. The urban access is around 80%, the urban access to basic water supply. But rural access is 35%. So there is quite a big gap already in basic access to water supply between rural and urban Burkina. and the same or similar gaps for the other countries, some bigger and some smaller, in India, Indonesia, Nepal, and Uganda. But if we're asking ourselves how many people do have access to water supply on the premise, then we see that in Burkina this gap is huge. So it's 77% of the urban population that has water supply on the premise and 3% of the rural population. And similarly, in the other countries, there are smaller and bigger gaps in having water supply on your premise. And last but not least, talking about sanitation, there's 39% of the urban population that has access to basic sanitation in Burkina, against 11% of the rural population. This again shows differently in India, Indonesia, and Nepal and Uganda. So all these figures are JMP figures from the measured in 2017, and the exact figures may vary somewhat, but we know that there are big gaps between rural and urban populations in terms of their access. Of course, there's also gaps between rich and poor populations. So if we look at access to basic water supply, for example, the richer wealth quintiles in Burkina have about 88% access to water supply, whereas the poorest wealth quintile has 49% access to water supply. And in India, the richer wealth quintile has about 88% access to sanitation. 88% access to sanitation, whereas the poorer wealth quintile has 10% access. So those kind of gaps we need to be very aware of when we're talking about the capacity to practice those hygiene behaviors suggested by the JMP, by the WHO. Of course, there's further gaps which are related to where you live or any individual characteristics that you may have. You may be living in an informal settlement, a refugee settlement. People are living in prisons or institutions. People with limited mobility or disability have different access often. And also people who are socially stigmatized. Sometimes women are not allowed to use certain services during menstruation, but there could also be exclusion of people from ethnic background, religious or sexual minorities, people with HIV, or people with certain professions. So what we want to, I'm trying to find a click here in Joost's PowerPoint. Yes. So, sorry. What we're trying to answer here is how do these inequalities in access to wash actually translate into differential capacity to mitigate this virus? And who are the people who are most affected? And how are they affected? What are the additional challenges and risks that they face? So when we talk about measures and think about what can be done, we consider those inequalities, but we also consider them in the longer term, because we know that COVID is not the only communicable disease that is out there, and we want to be better prepared. So that is the topic, and I'm really looking forward to hear the discussion. Thank you.
Thank you very much, Antoinette, for framing the discussions and setting the scene for our interaction. I'm also really looking forward to hearing the discussion, and I believe that the over 150 participants on the panel, on the platform now, are also eager to hear that. We're going to move straight into engagement with our panelists. The first on the list, we have Arnold from IRC Burkina joining us. Arnold has been working with IRC and together with some stakeholders have been doing a lot of advocacy on wash issues in Burkina Faso. Arnold, Arnold will be speaking in French, but we'll have the benefit of the interpretation. Arnold, in the presentation that was made by Antoinette, she did indicate that about 80% of the population in the urban area in Burkina have access, but compared to that of rural, we have only 35%, with only 3% having access to water and sanitation services on premise. It will be interesting to know from where you sit, how the COVID-19 and the response is affecting people in the place that you work, particularly for the rural dwellers in Burkina Faso. Hello, Arnold.
Oui, merci beaucoup, Vida. Je voudrais également remercier Madame Comé, Antoinette, pour son introduction qui plante très bien le décor par rapport à la situation, par rapport au contexte même que vivaient les populations avant l'arrivée du Covid. Je salue tous les participants et conférenciers, au passage, particulièrement ceux du Bénin. Alors, et du Burkina, bien sûr. Il faut dire que cette situation du non-accès qu'on vit en milieu rural, parce qu'on a parlé de 3%, et de l'accès important qu'on peut avoir au niveau des services de base en milieu urbain, mais qui est en même temps caractérisé par une grande interruption, une grande discontinuité des services, fait qu'on est dans une situation de déficience, de faiblesse déjà avant l'arrivée du Covid. La question, donc, c'est comment les mesures qui sont mises en place dès les premiers instants permettent donc à ces populations qui sont déjà dans un contexte affaibli de mieux faire face éventuellement au Covid. Et je veux rappeler que, vous savez, le Burkina vit aussi une situation un peu compliquée en matière de terrorisme. Et il y a environ 800 000 personnes de déplacés internes, selon les chiffres communiqués officiellement en mars 2020. Et donc, il y a aussi ces personnes qui constituent des gens pour qui il faut offrir les services sur les sites mis en place de façon urgente pour leur donner un habitat. Et donc, nous allons assister à ce que, avant le Covid, il y avait donc déjà ces 800 000 personnes. Et avec le Covid, on va voir que les gens ne peuvent plus aller travailler. Nous-mêmes, dans nos boulots, comme vous savez, on ne pouvait plus aller travailler. Jusqu'à maintenant, ce n'est qu'une reprise partielle. Dans certains milieux de travail, il y a eu les mesures de lavage des mains, distanciation sociale, limitation des réunions et du nombre de personnes dans les réunions et d'autres mesures particulières. Mais il y a des millions de Burkinabés qui ne pouvaient pas, pendant le Covid, aller travailler et donc moins de revenus. La situation de confinement a entraîné aussi une promiscuité dans les ménages vivant en grand nombre. Et plusieurs médias ont pu attester de cette situation que vivaient les populations. Et il y a eu donc les mesures mises en place par le gouvernement qui concernent la gratuité pour l'eau, dans la tranche sociale de 0 à 8 mètres cubes. Et donc, c'est censé profiter à des ménages à faible revenu en milieu urbain. La gratuité de la consommation au niveau des bonnes fontaines, toujours pour les populations en milieu urbain. Il y a eu l'annulation des pénalités sur les factures de la compagnie, la facture des consommateurs par rapport à la compagnie d'eau publique. Il y a également la prise en charge des factures d'eau dans les marchés. Le coût global pour ces mesures, c'est environ 6,7 milliards. Mais, tout de suite, il faut le dire, il n'y a aucune mesure à ce jour pour le milieu rural. Et comme Mme Comé l'a dit, le milieu rural, c'est 70% de la population du Burkina Faso. Donc, tout de suite, 70% de la population du Burkina, déjà en situation de faiblesse, exclut des mesures qui sont mises en place pour améliorer l'accès à l'eau et qui devraient permettre de mieux adopter la mesure de lavage des mains. Il faut dire aussi qu'en milieu rural, n'ayant pas eu de contrat avec le gouvernement, les services, les providers, les opérateurs ont donc appliqué, continué à faire, comme par le passé, les mêmes tarifs. Très peu ont mis en place des mesures de distanciation sociale ou de lavage des mains au point d'eau, par exemple. Voilà. Et donc, le Covid est venu rendre davantage difficile la situation, non seulement de l'accès, mais aussi pour faire face, parce que l'approvisionnement en pièces et en produits, produits pour corriger la qualité de l'eau, c'est compliqué.
For giving us the background on the situation. We'll come back to look at what is being done to address some of these. But before then, we'd like to also hear about from the other panelists, what the situation is in their respective countries. The next panel member is Mr. G. Marty Vadhanan. Mr. Vadhanan, thank you for joining and accepting to be a panel member. You are joining this session from India, and we know that as a government official, you've been leading the government's efforts in mitigating the COVID, particularly looking at issues on WASH. It will be interesting to know the situation of employees and maintenance workers in delivering water and sanitation services during this COVID pandemic period. How are you handling the situation of sanitation workers? Apart from what is happening in India in general.
Thank you, Vida. Thanks for the opportunity. Good morning, good afternoon, good evening. So I'm from India. I represent a state called Odisha. It is in the eastern coast of the country. So we have a 7 million population. So during the pandemic, our fight with the pandemic has been very, very challenging, as it's in other parts of the world. So the advantage which we had is that this state has been witnessing a stable government for the past 2 decades. That means from 2000 onwards, the same party and the same leader is governing the state. This strong political leadership has created and put in place an able team during this kind of crises or disasters. So this state experiences cyclone almost once in 2 years. Once in every 2 years, we have been facing cyclones, disasters. So our teams are well positioned, and this time it is COVID, which we are currently managing. At the outset, I would like to say that the morale of the team has been kept very high. The teams are well prepared. Normally, during this period, we are in readiness during the monsoon. So one of the very important factors for keeping the morale of the team, whether it comes to the health team or the sanitation team or the water supply team, all teams put together which fights the COVID pandemic. So government has announced that the COVID, in fact, we have declared COVID as a disaster right from the beginning. Even before the country has declared this as a national disaster, the state has declared this as a state disaster. And then we actually waged a war against COVID. And we called all our workers as COVID warriors, whether it is the medical professionals or doctors or nurses or paramedics or water supply workers or sanitation workers or policemen on the duty enforcing, all of them are called COVID warriors. And then we said that it's a fight against, it's a war against COVID. And the Honorable Chief Minister of the state personally, led these teams. And the government has ordered that since the pandemic has come closer to us, it is surrounding us, anyone can get infected. So realizing that keeping the morale of the force is very important, they said that the COVID treatment would be free for all, public, everybody. Second thing is that extensive health infrastructures have been created at jet speed. Then third is the insurance coverage has been introduced for the COVID warriors who are interested with the COVID duty. So that is the same insurance coverage for everybody, whether it is the frontline doctors or nurses, paramedics, or the water supply or the sanitation or any service provider, facility manager of all these COVID care institutions. So everybody has been included in this. That has given a big moral booster for the force. And second thing is that the management has been decentralized. In fact, we have taken the COVID management to the community level, and we have empowered the community level institutions, the democratically elected institutions at the grassroots level. And not only empowering them, we have also enabled them with the required human resources support. We have enabled them with the required financial resources to manage that. They have been given the responsibility to manage the COVID care homes, the isolation facilities, the temporary medical center. In fact, Odisha, our state has witnessed inflow of large-scale migration. The migrant workers who were working in other parts of the country, they all returned back after this COVID lockdown, shutdown, and the complete economic activities have come down, stopped. So they all returned back. They were in huge numbers, about 700,000 migrant workers have returned in a short period of about 45 days. And the districts in which I am kept in charge as COVID observer, so we have seen about almost 300,000 migrant workers returned because of this COVID pandemic. And they are all, distributed in all the villages and urban areas. So to manage that additional load, to cope with the additional requirement of water and other infrastructures has been a great challenge. But fortunately, in fact, we have been kept our, pro-poor initiatives right from beginning. Our initiatives include pipe water supply to each and every household, at least in the urban areas. In the rural areas also we have, but in urban areas we have ensured that there is a pipe water supply to each and every household. That we have been implementing from 2017 onwards, which is in the last leg of completion. Almost 60-70% of the houses have been provided with the tap water pipe connection, and toilet for all, sanitation for all. That mission also has been recently completed. So every household has an access to either a individual household toilet or a community toilet, shared toilet. So that also has been in place. So all these things have enabled us to, manage this pandemic in a better way. And during this, we have also, in fact, we have been building partnerships.
Thank you. I think we'll pause here. We'll have another opportunity for you to talk about the partnerships, and then also how by putting in these systems, it's making it, you more resilient and being able to address and respond to the COVID situation. Thank you very much. We move on to the next panelist. And our next panelist is Mrs. Rama Daha, who is joining us from Nepal. Raha from Nepal and has been working a lot with the Disabled Association dealing with the issue of COVID in the country. Rama, can you please tell us what is happening in Nepal and how are people living with disability adjusting to this unusual situation?
Yes, thank you, Vida. Thank you so much for the opportunity. Yes, all of you know that I'm a woman with disability, one of the activists. I'm doing the activism here in Nepal. And all of us know that the COVID-19 was, it came all of a sudden, and we don't know about this, how to respond in this pandemic. But as an FDN, because that's a person with disability are more traumatized at this situation, especially for the person with disability who have the severe disability, like who are using the wheelchairs, and also we have 10 type of disability. For those people, it was really a worse situation, because we haven't think about that there will be too much long lockdown for us. So that's why we are compelled to sit inside the home, and we don't have I mean health packages like sanitary pad, water, and then also catheter, you know. So that's thing, and it was really horrible that time. So that's lots of friends, they start to call us what NFDN is going to do. It's a National Federation of the Disabled Nepal. So it's an umbrella organization, and we started to do in three styles. I mean, like one is like for the access to information. As I already mentioned that we have 10 type of disability. So deaf people, they cannot hear anything. So what's going on, you know, what is the situation of pandemic? So in that situation, we try to do advocacy to the Ministry of Health and also with the Ministry of Women. So that's why we could establish we can provide the sign language interpreter for those people. And also we work for the in the humanitarian support also, like we provide some of the health materials to the really needed person, like severe disability who cannot go outside of the house, who are compelled to bound inside the house or in the wheelchair. So in that situation, we also like work with the province level. We have the 7 province level offices, and in that 7 level province level offices, where that government also have the cluster. It's a protection cluster, and some of our DPOs, they are also connected with that cluster, and they complain the issues what they need and all these things. And then sometimes they phone us, sometimes they SMS us, and they talk about the problem. And we do that things by our member organization. And also we did advocacy at the province level to make the guideline disability provision, like how that if that quarantine is for all type of people, then why not for person with disability? We were doing the advocacy to the government. So think about the universal design, not only the disability things, but think about the universal design, so that all the person can, you know, live safely at that time. And also we NFDN did the rapid assessment, like how is the situation a person with disability living in the village area, you know. So, and we got the information by that rapid assessment, by that finding. We did the lots of advocacy to the community level by engaging some of our other INGOs also. They supported us, like SNV, CBM, you know. So they came together to cope the situation in this pandemic. So we as
Right. Thank you. Thank you.
federation. Thank you so much.
Thank you, Rama. We'll have opportunity for you to come back and then you elaborate on the intervention measures. Thank you for sharing with us what is happening in Nepal. We'll move on to Uganda. And we have Godfrey joining us, Godfrey from the Ministry of Water and Environment in Lira, Uganda. Godfrey, how is the situation in Uganda, particularly for people without water and sanitation on premise? And what are you doing about that as government representative?
Thank you so much. I would like to first thank you for this opportunity to make a mention of what the government of Uganda has done. First and foremost, when this COVID was registered in the country, we started by having mass media hand-washing campaigns. And what this essentially meant was we needed to have all the communities being able to wash their hands with soap. So various standard operating procedures were made and were put mainly at most of the public places, the water points and the markets. I would like to mention that in the rural communities of Uganda, most of the water is supplied from point water sources and some pipe schemes. However, the level of service right at the doorstep is still very low. So we still have many communal water points. And that notwithstanding, the government also prohibited the disconnection of water supply to most of these communities. However, they did not waive the fees, but were just told to stay collection, but ensure that they always have a lot of water. Now, when it comes to the point water sources, we found that there are many issues that regard the service, and we find that the water quantity, quality, reliability, those are issues that came into play, and the repairs. You know, many of the systems or many of the point water sources have actually are not quite new, they have aged, and as such require a lot of repairs since the use becomes higher. And that was also complicated by the fact that many people left the urban areas and went back to the villages. So it put more pressure on the water points. However, interestingly, the campaign was mainly on hand washing with soap, but we found that the hand washing facilities that were put in place, in many cases, the issue of soap became a problem, especially to the rural communities. And we found that much as most of the people in the rural are in position to afford soap, they're not really willing to repurpose it for hand washing. So we had to kick in and start a major drive in trying to promote the hand washing with soap. The other issue which we're looking at was how do we create these hand washing facilities? And we also, the basic one and the best one at the village level would be the tippy tap. So we tried also to try and train the communities on how best they can make simple tippy taps and make use of them as far as this was concerned. Now, the many people who are mainly affected are the people with disabilities, the elderly, and the vulnerable. So we try to ensure that under the SOPs to try and have the communities ensure that these vulnerable people also access this facility. Then, so basically, as far as all this is concerned, it was mainly.
Oh, thank you. Thank you very much, Godfrey, and thank you for outlining all those interesting measures. We'll have opportunity to come back to digest them further. We move on to our last but not the least panelist. And our last but not the least panelist is joining us from Indonesia. We have Susu Sadia joining us from Indonesia. Susu, welcome to this session. You've been doing a lot of work for people living in institutions, particularly for people living in shelter homes and disaster prone areas. Can you please share with us the experience in Indonesia as we speak?
Yes, thank you, Vida. Good afternoon, good morning, and good evening, everyone. It's my pleasure to be with you all now. So I'd like to talk about the experience of what CBM has been done during the, from the perspective of the experience of people with disabilities. So as in the earlier from our colleagues from Nepal, we heard about what are the barriers that faced by people with disabilities. Yes, for during this COVID, people with disabilities is actually, they are increase contracting COVID-19 because of the pre-existing barriers. For example, in accessing wash facilities. And then here I'm going to talk about the experience from our work before the COVID. That's been in the disaster affected areas, where for those people, the barriers even more doubled. And then during this COVID, of course, getting water, it's also the challenges. Getting water, sanitations, and even for the hygiene needs, that's also challenges for them. So if the persons with disabilities do not have wash or water at home, then going out in the community for water and sanitation poses even bigger challenges. So many will require more hygiene measures. So for example, people who are using a manual wheelchair, who needs more help, for example, to get the wheelchair clean, and also for people who are blind, for example, to get help, orientation. That's those people cannot really avoid from the assisting lots of touch hands. So this will increase the risk to contracting the COVID, and like yet getting soap and water will likely be even harder for those groups. So in our experience, by getting in our experience working in the disaster affected areas where people with disabilities are most forgotten by any of the organizations or even from the government. So we tried to work on how to provide accessible toilets at their homes, but also to provide shared toilets in the shelters, which is, of course, this needs not only providing the facilities, but also educations on how to use it to people with disabilities itself and the communities. So lots of learning from what we have done, and I think what is the relations what is the even greater risk is for the women and girls with disabilities, that they will face double risks because of the, for example, it will lead to risk to the sexual abuse if we are not really protecting them. So
thank you, Tutu.
Yeah.
On that
Okay.
note of the risk, we'll pause. We'll come back in the next round, and then you talk about how you are working to mitigate that risk. But thank you, all our panelists, for sharing the situation that you find yourself in. It's good to know about what is happening across the globe. We are not leaving our participants out. We've all heard what is happening in the respective places presented by our panelists. We are going to have our second pool where participants on this platform would also share their perspective from where they sit. The pools are opened now. Kindly visit the pools and make sure that we register your inputs. Remember, there are multiple questions, so scroll down to answer all the questions. When you finish, submit your questions. Look out for and hear the interpretation in Spanish and French. Be getting ready to submit your information. The polls will close in the next 10 seconds. Thank you for submitting your information. We'll now pick the results from our polls. Whoa. So at the end of the polls, about 40% of us are of the view that the COVID situation would lead to substantial additional amounts being spent on wash. 47% aren't too sure, no substantial changes in spending. And 15% are of the view that it will rather even lead to reduction. On the question whether we think this money is being adequately targeted to reduce inequalities, 13% of us are of the view that it will. Oh no, 63% of us are of the view that it is not, and 24 don't know. Which potentially marginalized groups do you think deserve more attention in what sector? 52% of us are of the view that it is the rural population. 63% the view that it should be the poorest household, elderly 33%, persons with disability 57%. And then we also distributed it across the other segments of the population. Thank you for submitting your polls. The feedback suggests that, yes, the inequality can also be diverse. And as we target, we should also ensure that we are also looking at the diverse interests that we have ahead of us. We would encourage you to post your questions in the chat. And at this point, we'll be picking your questions and going back to our panel members to respond to your respective questions. So kindly post your questions if you haven't already done so. Thank you for posting your questions. I already have some of your questions, so I'll start taking them to the panelists, and as we receive more, we would also follow through on that. I have a question here from a panelist to Godfrey from Uganda. Godfrey, a panelist want to know whether the Ministry of Water is assisting people financially to construct TP taps. And
No.
how are community water management committees supported in this crisis?
Okay, on the issue of TP taps, we do not financially assist the communities. We only advise them on how to do it, because many of them do not have the technical know-how on how they can construct one. So we just have some models and show them how to do it. Then on the community management cases, community management committees, I would say that at the beginning, each district in Uganda had a district task force, and of which they looked at their priorities towards the COVID response, and the money was disbursed for wash-related activities. And what was done here mainly was towards the repairs of water systems that were not functional, and also extensions of water to areas where they felt they needed them, especially places like the quarantine centers. And also the training of the community management committees. This was done extensively in many of the districts to help them know how best they can operate and maintain their systems. This has always been a continuous process, and this is handled through the established government structures and the.
No, I don't know if it's only me, Philip. It appears we are not getting you well.
On the second one, on the community management committees, they were supported during the COVID crisis. How it was done was through the.
Thank you very much. Thank you very much, Godfrey. There's another question that I'd like to defer to Mr. Vatnam. Please, you are working in India and you are a government representative. There's a question about what strategies can be considered in delivering water services to far-flung last mile areas. Do you have any experience to share with us on that?
Yeah. In India, what we have done is that in WASH, both on water as well as sanitation. We have involved the community-based institutions in a bigger way. Community-based institutions involve the women self-help groups, the transgender groups, the Slum Dwellers Association, which are the low-income settlements. They are from the low-income settlements, the Association of the Residents. So these community-based institutions have been involved in a bigger way, and we have, in fact, handed over the management of these community-based assets and facilities like public toilet, community toilet, the community compost center at the for composting, the dealing with the solid waste in the urban local bodies. So septage treatment plant for treating this septage from the septic tanks. So all these things, we have developed these community-based institutions, trained them, hand-holding them, mentoring them, empowering them, and then we signed contracts with these institutions to manage for 1 year, 2 year on terms and conditions on a service fee. So if you take sanitation in view, starting from public toilet, community toilet, to the transporting the cesspool, to the septage management, complete responsibility has been given to the women self-help groups. Yes, similarly, in the solid waste management also we have done. In the water supply also, we have engaged the community-based institutions like the members of the self-help groups as Jalsati. Jalsati means the waterfront. And they have been entrusted with the responsibility of managing the distribution of water at the community level, at the ward level, the grassroots level, and collecting the user fee and reporting any complaints public for the complaint redressal, and taking up the preliminary quality control measures. They have been trained. So they have been working as our agents. So we have, a partnership with the community-based institutions. This has helped us tremendously during the COVID management. When there has been a lockdown, when there has been restriction on the movement of the vehicles, public movement, people movement, and when the contractors could not travel with their staff, these community-based institutions were very handy in managing these institutions. That helped us actually. And in toilets also, hello, yeah.
Yeah, thank you. I think because of the time constraint, but I'm sure most panelists, participants may follow up with you later for more information on what you are doing. Thank you.
Thank you.
I want to now move on to Rama. And Rama, what do you think in the short term can be done? And what can also be done in the long term to sustain and ensure that even beyond COVID, we are able to focus on the need of the excluded?
Yes, Vida, thank you so much. I think that we have to be very much like, if you are talking about in this pandemic situation, we have to really very much think about that, that's especially for the girl woman with disability, like because most of the women with disability, they are in the family, but also that who are living in the rented house, in the rented room, if they are using if they had a menstruation period, at that time, how they are handling, how they are managing the menstruation pad, sanitary pad, that things, it's a really very problem for us. And we don't have a safe, clean water, either for the drinking, also for the clean, so in that way we have to now very much focus of that things. If you are going to the community school, please think about, if you are making the school, so think about I'm also now focusing about the universal design for the WAS also. So how we are going to do that things is like, when they have the committee, so please include the person from the disabled people organization who could give the good planning at that time. And also, like, for this period, for the COVID, if we have offices and all these things, and we have a toilet, so if the disabled persons is going inside the toilet, they should know Where is the sanitary pad? Where is the tissue? Where is the sanitizer? Where is the soap? Because we blind people might not know where is the placement of that things, you know. So in this situation,
Thank
we have
you.
to really
Thank you.
think about that things. Thank
All
you.
right. Thank you. As we think about that, let's also move on to Tutu. Tutu, what do we think about in the long and short term?
Yeah, from me, I think to Rama, so for the short term, we have to ensure that wash facilities and equipment are accessible for all, ensure behavior change campaigns reach people with disabilities, and then reach out to people who might not access service or information. That's very important. And ensure personal wash support can continue, identify and address specific risks of harm to people with disabilities. And for the longer term, the crisis shows that the huge impact of inaccessible communal services, given some people will be relying on those. And then we have to emphasize that the needs of communal services must all be accessible. So for this thing, that advocate for inclusive wash response to COVID is very important. And the other thing, for example, is training for the stakeholders and frontline staff.
All right.
It's very important.
Okay.
Yeah.
Thank you, Tutu. We move on and finally to Arnold. Arnold, how do we advocate to sustain the interest in focus on WASH and particularly the excluded and eliminating all the inequalities? Arnold?
Oui, je vous entends. Est-ce que vous m'entendez?
Yes.
OK. Vida, merci beaucoup. Déjà, il y a des mesures concrètes qui peuvent être mises en place au profit pour limiter, par exemple, les risques de contamination des femmes et favoriser en même temps la vulgarisation des mesures barrières dans les ménages. Ce sont les femmes qui collectent l'eau. Si on met en place les mesures barrières au niveau des bonnes fontaines, au niveau des ouvrages simples, et qu'on sensibilise les femmes là-dessus, on sponsorise la distribution des masques, ça va contribuer à limiter la propagation et faire du point d'eau un point à partir duquel on lutte contre le COVID efficacement. On peut avoir un programme de réhabilitation et de maintenance des ouvrages simples. On connaît le nombre d'ouvrages qui sont en panne et on peut le faire très rapidement. On peut mettre en place les tickets prépayés pour permettre aux populations vulnérables d'avoir l'eau gratuitement au niveau des bonnes fontaines et des PMH. On peut soutenir les vidangeurs et on n'a pas parlé d'eux. Ils sont aussi très vulnérables.
Thank you, Arnold. Thank you. Thank you. Thank you. I think that we are a bit pressed with time, but on that note of making water services free to the vulnerable so they can also benefit, we would like to go on to our last pool, just to quickly pick our takeaway, and then we will take our closing remarks. So the polls will be displayed soon. Kindly take your responses. Kindly submit your responses. Thank you for submitting your responses. We'll get the poll results soon. We're still waiting for our poll results. Kindly submit your responses, and then we pick our poll results. So at the end of the poll, we have 63% of us with a view that the stories have changed our thinking. And then we have about 57% of us that we will see some legacies in the COVID pandemic. On that positive note, we'd like to turn over to Michael to give us the closing remarks.
Good afternoon, everybody. This is Meike Verginneke. I'm the CEO of SNV, and I think we've had a very interesting discussion of the inequalities in WASH and how the COVID pandemic and the response to the COVID pandemic actually shows these inequalities, but also makes it even more urgent to pay attention to and to resolve these inequalities in water and sanitation and hygiene service level. I think it's clear to all of us that WASH is a critical issue in the COVID-19 pandemic and limiting the spread of corona. Rightly so, the very short-term attention is on hand washing stations, hygiene promotion for hand washing, and distribution of soap and disinfectants. This is necessary, it's quite expensive, and it's not enough. So I just want to say a few words on why this is not enough and what we need to do more. I think even for these quite simple measures, hand washing stations, distribution of soap, if we talk about inequality, I think the first question is, do these short-term pandemic measures, these emergency measures, reach all? If there is distribution of soap and disinfectant, do all households receive this? Does everybody, all neighborhoods have hand washing stations? Is hygiene promotion inclusive? And all the questions we normally ask about inclusiveness in water and sanitation and hygiene also apply here. We need to make sure that these measures reach everybody, including vulnerable groups, such as the poorest, female-headed households, disabled people, and people of different ethnicities. So I think that's the first question. Just the very stopgap measures need to reach all and be inclusive. I think the second point is, do we do enough, is that the crisis shows the inequality in WASH between those with and without access to service. And especially, it shows the difference between those with services in their home, on premise, and people depending on shared facilities. As we worked on access to water, sanitation, and hygiene in the past decades, we've rightly focused on giving some access, the lowest step on the sanitation ladder, or the minimum of water through shared facilities. The corona crisis really puts our attention on highlighting the limitations of these shared facilities. Improving hygiene or practicing social distancing is difficult if you depend on a communal toilet or on a water point and have to get out of the house. Shared water points, whether it's a hand pump or some other borehole, are now possible sites of infections and become actually a risk factor rather than a service. Let alone going to a shared toilet at night. How do you social distance? How do you make sure you don't actually increase your risk of getting corona while you're trying to use those facilities and decrease the risk of other infections? Stay at home and self-isolation is just not possible if you need to leave the house to use shared facilities. And if you don't have access for water at home, you're likely to practice hand washing less frequently. So people who depend on shared facilities are really at an increased risk here. What do we do about that? In the short term, we don't have a choice but to take social distancing measures and make these shared services accessible and keep them clean. Close some of the toilets in a shared communal toilet block. Make sure that queues are properly spaced. Make sure all these points are properly maintained and are clean. I think another thing in the short term, which is really important, is focus on household water storage. If you don't have a tap in the house, you still need water stored and accessible to frequently wash your hands. In the medium term and in the long term, COVID-19 is showing us that water and sanitation on the premises is necessary for all. We probably need to reconsider what's the minimum standard we want if indeed COVID-19 and the need for social distancing and increased hygiene will be around with us for the medium term, which is likely. That also provides an opportunity for WASH professionals around the world to actually lobby for more financing, and increases the profile of water and sanitation in all the priorities that governments have. That brings me to my last point, which is actually on public expenditure. One of the quizzes or one of the polls that we did today was on public expenditure for WASH and what's happening to that in COVID-19. And I noticed that half of the participants said there's no substantial change in spending on WASH. 40% of all of us reported that there is substantial additional funds for WASH. That's good. I mean, some of that will go to expensive short-term measures, but it is an indicator that WASH is important for governments. I actually look back, I did a long time ago, more than 10 years ago, I did a public expenditure review on WASH in 15 countries in sub-Saharan Africa. At that time, public expenditure averaged 0.39% of the gross domestic product, which was less than $2 per year per person. Well below what is often seen as a benchmark, 1% of global domestic product, and about 1/10 of what's needed at that time to meet the MDGs. What we also found at that time is that only 2/3 of the budget was actually executed, was actually spent. So the fact that there's more money available doesn't mean it's actually being spent. And the third thing which we found was that public expenditure on WASH was very, very, very badly targeted. And it actually increased inequalities rather than reduced it. And there's different parts of this. I mean, one is at the global level, actually donor expenditure. What you actually see is that there's more donor expenditure on WASH in middle income countries, which get donor money for big sewage plants or for other expensive things. And there is actually very little donor money going to the poorest countries and fragile states. That's still the case 10 years later. But also within countries, probably more importantly within countries, most money goes to piped water supply. We need to change that. We need to make sure that public expenditure for WASH goes up.
Thank you, Antoinette. Yeah, and on that note,
it goes up. Secondly, it needs to be executed. And thirdly, it needs to be better targeted. Only then can we sustainably address the inequalities in WASH, which is an urgent priority during Corona. Thank you, Vida.
Thank you, Antoinette, for that closing remarks. We thank you all for joining today's session, a session that we have all reflected on inequalities in WASH services levels across the globe. We encourage you to join our next session and look forward to seeing you. We'd like to thank all our panelists and all our speakers, and for you who joined us to make today's session a reality. Kindly note and join in to another session that will be held by Water Aid and partners on the 23rd of July, which is going to be on including persons living in informal settings in WASH responses to COVID-19. We urge you to join. We look forward to seeing you again at the next event that we'll be having with SWA. Thank you and have a good afternoon, a good morning, and a good evening. Bye-bye.
Bye. Thank you.
Bye. Thank you.
Thank you.
Bye-bye.